Perfect.
Well, good morning and good afternoon, everyone. Thank you so much for joining ONEgeneration's Health and Wellness Webinar Week. We are so grateful for all of you taking your time today and just joining us and participating and bringing so much energy and excitement to just all of our presentations. For those of you who do not know me, my name is Niambi Cooper, and I'm the director of ONEgeneration Senior Enrichment Center, and we're led by our organization's president and CEO, Jenna Haas. So this webinar layout will be composed of first having our presentation by Paul, and it'll be roughly about 45 minutes, and then we'll follow up by questions and answers at the end. But please feel free throughout the entire presentation to use the chat function at the bottom part of the screen. We'll also have a Q&A box at the bottom if you would like to ask a question anonymously. You can do that, and we do have a raise your hand function at the bottom, and that just simply means that you're able to verbally ask a question if that's more comfortable for you. So this presentation is being recorded, and that just means that we're able to place this video into our newsletter and online, so you can easily access it and just share, of course, with friends and family. And if you do not receive our newsletter, we can get you signed up if you just call our center, our main number at 818-705-2345, or you can just go to our website at onegeneration.org and sign up yourself by inputting your email, and you can start to receive our newsletters on a regular basis. So I'm super excited to introduce from Paul Davis Insurance Services, Paul Davis, and we also have Jerry Fisher here with us. So 2021 marks Paul's 37th year in the insurance business. He is recognized as an expert in Medicare health plan options and has a passion for helping people get the best value. Paul is a 27-year member of the National Association of Health Underwriters. He is a true health insurance professional. Paul was voted Best Insurance Agent by readers of the Daily News for the past 19 years. He has also been recognized by the San Fernando Valley Business Journal as one of the Valley's trusted advisors. Paul has run his own insurance office since 1991 and currently has a staff of 6 employees. He has been a supporter of ONEgeneration since 2003 and was honored at our dinner for our 2019 Trailblazer Award. Today, Paul will be presenting on what you should know about your Medicare health plan options and why it's important to shop early. So Paul, Jerry, thank you so much for being here with us today. We're super excited just to jump in.
Okay, thank you so much. Welcome everyone, glad you could make it. So you've seen my picture and some background. Just about every person we talk to about Medicare has some confusion. So I think as people approach Medicare, they're looking at this, how do I navigate through this, and how do I get to the other side and get things taken care of? And that's what we do. That's the only kind of thing, that's the only kind of insurance we help people with is Medicare. You may have seen some of my ads recently, kind of a fun thing. It's an insurance jungle out there. Let me be your guide and help you navigate this. I've got my associate, Jerry Fisher, on the line. He's been working with me since 2016, and he is really my go-to person, my expert in shopping Part D prescription drug plans. He has literally shopped probably 5,000 or 7,000 people in the last couple of years, so we know what to look for. So we really know the nuts and bolts of applying for Medicare and Medicare health plans. And again, Medicare is the only focus of our practice. We do not do any other kind of insurance whatsoever. When people see the slides, several have pointed out, they say, well, it looks like you probably also have a few loose screws. So we do have a sense of humor about ourselves and try not to take ourselves too seriously. So if you have questions, Jerry's going to be watching the Q&A and the chat box. And if I miss something or something needs to be clarified, Jerry will break in and let me know at that point. And if not, we'll wait till the end and we'll address all the questions. If you have a question on a particular page, they all have page numbers at the bottom right-hand corner. Make a note of that so we can refer back to that page and clarify questions that you might have. So Medicare health plans, I'm going to go through a quick review because again, everyone I talk to has some confusion, misunderstanding, uncertainty about Medicare. So what Medicare is a federal health program run by the CMS and the part of the U.S. Department of Health and Human Services. Original Medicare eligibility. So you become eligible for Medicare typically when you turn 65. Sometimes people have some confusion about Medicare versus Social Security. because Social Security, you can start at some different ages, but you typically have to be 65 years or older to be eligible for Medicare. However, if you're under age 65 and have end-stage renal disease or ALS or have been disabled for more than 2 years, you're entitled to enroll under age 65. You need to be a US citizen or a legal resident for at least 5 years. So the parts of Medicare, Medicare Part A is hospital, skilled nursing, hospice care, and home health care. If you've worked in the US economy and paid taxes for at least 40 quarters or the equivalent of 10 years, then you have no cost for Medicare Part A. People that have immigrated to this country that haven't contributed to the system, or we know some people that they got paid cash and they didn't always report it. They're charged as much as $458 a month for Part A. So if you paid taxes, you are getting some benefit from those taxes. Medicare Part B as in boy covers doctor visits, lab work, x-rays, durable medical equipment, chemotherapy, radiation therapy, ambulance rides, a whole slew of things, basically things that are not in a hospital setting. And the cost for Medicare Part B is for most people is $148. Looks like I have an update, $148.50 a month. Sorry, I've got 2020 in there. But there is an income component. So you can be charged more than that based on your income in the year 2019. So I show this somewhat for people that are approaching Medicare, but also as I'm talking to someone that's just enrolling. So again, based on your income in 2019, most people are paying $148.50. But if you're filing jointly or filing singly and your income is above these levels, then you can pay as much as $504.90 a month just for your Medicare Part B as in boy. And if you also have drug coverage, you have a corresponding additional premium on this side over here. And what can happen is I've had people that started out and they were paying the lower level and then they sold a property and they had a big income in that following year. They get bumped up just for a time period on this. So watch out for that, know this, and also maybe factor this into some of your financial planning decisions. So if you think you're paying more than you should for Part B and you've had a life-changing event, so that would be marriage, divorce, death, work stoppage. Most commonly, it's people that we know that are retiring and they had very good earnings, but going forward now, they're not going to be working, so their income has dropped dramatically. There is a form, the SSA 44 form, that you can go ahead and submit, and that will result in a reduction in your Medicare Part B and possibly elimination of the IRMA for the Part D prescription drug plan. So it's definitely worth filling out this form. Who needs to enroll in Medicare? So if you're under age 65 and you've been on Social Security disability for 24 months, you'll automatically get enrolled in Medicare Parts A and B. If you're turning 65 and you have no health coverage, then you definitely want to enroll in Medicare. And if you're turning 65 and you're on an individual health plan, even if you're on Covered California, you want to enroll. People on Covered California oftentimes have a significant subsidy that's reducing their health costs dramatically. And I've had people, well, I'm just going to stay on that because that's so much cheaper than going on to Medicare. But the moment you become eligible for Medicare, you lose that subsidy. And Covered California hasn't been really great at notifying people of this. So I've had a few people relate some horror stories to me where they thought they'd stay on Covered California, and then the following year when they filed their taxes, find they owe $5,000 or $6,000 or $7,000 back because they were no longer eligible for that subsidy. So it's a good thing to take a look. If you're on a group plan through an employer and they have fewer than 20 employees, you need to enroll in Medicare because Medicare will be primary payer and the group in that size group will be secondary. If you don't enroll when you're supposed to enroll, you have a special enrollment period between January 1st and March 31st, but you'll likely end up paying an extra 10% penalty on Part B for every year you didn't enroll when you were supposed to. So I get calls all the time, all week long from people that are not sure what they should do. And I'm happy to understand their circumstances and tell them what they should be doing, what they should be enrolling in. When you initially become eligible for Medicare, again, for most people, it's when you turn 65 and you can enroll the 3 months before and the 3 months after your birthday and the month of your birthday. Who does not need to enroll in Medicare at age 65? So I get calls from people that everyone tells me I need to sign up for Medicare. Okay, what is what is your health coverage? What's through my company? How big is your company? More than 20 employees? Oh yeah, it's got hundreds. Okay, how much does it cost you? I'm not paying anything. Are the benefits good? Yeah. Then you don't need to enroll in Medicare. And usually they go, are you sure? And yeah, so if you're in a group of more than 20 employees, that group coverage is considered to be primary and Medicare is secondary. We have been starting to recommend that people in those circumstances might want to enroll only in Part A, which has no cost, because I've had some people relate to me that they were hospitalized and the group plan paid, and then Medicare paid something in addition to that. But you generally don't want to enroll in Medicare Part B if you're on a large group, because you're going to incur a cost and generally not have any additional benefits derived from that. So stay on group plan or transition to Medicare. It's mostly a math problem, and I help people figure this out. Well, if they left the group plan, how much would their Medicare be? How much would their IRMA be? And then how much are they paying now? And we do that and figure out whether they should stay on their group. I'd say probably 80% of the time, I tell people that they're better off staying on their group plan. The prescription drug benefit on group plans is generally a little better than you can get on Part D. So there are some special enrollment periods other than when you first turn 65. And the most common one we use is when people are retiring after 65, they're losing group health insurance coverage and they need to enroll in Medicare. So you have a guaranteed time period to enroll from 8 months from the time you lost your group health insurance coverage. Now, be careful of that special enrollment period. If you lose group health insurance coverage and the company offers you COBRA, even if they say they're going to pay for the COBRA, you probably still need to enroll in Medicare at that time. There's a general enrollment period. So if you missed when you should have enrolled, typically this is people that were asleep at the switch and they should have enrolled when they turned 65, but they didn't. Then you wait till the following year, January 1st to March 31st, and you can enroll for a start date of July 1st. Now they're looking at maybe changing this. So, because it's a really awkward way to get people enrolled. Hopefully some point in the future, this will be less onerous. So once you've got Medicare Parts A and B, and that's the red, white, and blue Medicare card, then we have several different ways you can go forward. You're going to want to get some prescription drug coverage because Medicare alone doesn't cover prescription drugs that you pick up in a pharmacy, and some of those can be pretty darn expensive. So we have some people that just have Medicare and a prescription drug plan. You can also add what's called a Medicare Supplement, also known as a Medigap plan, and a standalone Part D prescription drug plan. And then the third option is to enroll in what's called a Medicare Advantage plan, where it incorporates your drug coverage as well as your Medicare Parts A and B. In all of these scenarios, you still need to continue to pay your Medicare Part B as in boy premium. So prescription drugs, talk a little bit more about them. In California, there are 32 plans available, and they range in price from $7.20 to $130.40. We take a look at all 32 plans whenever we're shopping for someone. So you can obtain this on a standalone basis or as part of a Medicare Advantage plan, in which case it has no additional cost. There is a late enrollment penalty for Part D. So when you turn 65, if you don't sign up for Part D, and you don't have other coverage that's considered to be creditable for Part D, then you're going to incur a penalty. And that penalty is about 40 cents per month that you're not enrolled. That doesn't sound like a lot, but I have a couple of ladies that never signed up for Part D when it first came out, and many years later decided to enroll, and they're paying about $55 a month in penalty, and they will continue to do so for the rest of their lives. So Part D is a very confusing animal, and this is the simplest slide I've come across to try to share with people how it works. So there's a standardized Part D plan where you have a $445 drug deductible, and then you have an initial coverage where you have certain co-pays for each of your prescriptions, depending on how expensive they are, whether they're generic or whether they're brand name. Then you have a coverage gap that occurs after you've purchased drugs with a retail price of $4,130. That's not the price that you paid, that's the retail price of the drugs that you purchased. This is considered the coverage gap, used to be called the donut hole. They're trying to phase out that phrase. And then once you purchase drugs with a retail price of $6,550, then you go into catastrophic coverage where you have a small copay or you're paying no more than 5% of the cost of those medications. And then every January 1st, this cycle starts over again. So Medicare Advantage plans are an option. If you watch any TV at all, you've seen a few dozen ads for Medicare Advantage plans. I think Joe Namath is the most frequent person I'm seeing on TV right now, and they make it sound like the greatest thing since sliced bread. So Medicare Advantage plans do cover the benefits under Medicare Parts A and B. Most of the plans also have coverage for prescription drugs. All the plans that we work with have coverage for prescriptions. In California, in Los Angeles, there are 59 available plans. 58 of those are HMO plans, and a lot of those plans have no monthly premium. Most of them have out-of-pocket costs that are capped at less than $1,000. So even if you're very sick, you're hospitalized, you need cancer treatment, time in a skilled nursing facility, the most you'll pay is less than $1,000. The networks have expanded dramatically in these plans over the last 10 years that I've been working with them. And you can now get a Medicare Advantage HMO plan that includes doctors and hospitals from UCLA and Cedars-Sinai. These plans are typically guaranteed issue when you first become eligible, and you're able to enroll in them also every year during the annual election period. You cannot have a Medicare Advantage plan and a Medicare Supplement plan, and you must be enrolled in Medicare Parts A and B in order to enroll. Again, a lot of these plans have hearing, vision, dental, over-the-counter benefits, chiropractic, a lot of additional benefits beyond what basic Medicare offers. Medicare Supplement plans is another option. Over 14 million Americans are Medicare Supplement plans. The main attraction to the supplemental plans is you get direct access to any Medicare contracted provider. So it's not an HMO. You can go directly to a specialist. You can go to doctors in Los Angeles. You can go to doctors with Cedars, UCLA, City of Hope, USC. You can even go to doctors outside of California. So as long as they're contracted with Medicare, you have direct access. And the plans that we most commonly enroll people in are Plan G, N, and F. Plan F is only available if you turn 65 before January 1st of 2020. So if you're a little younger than that, like me, I'm only going to be able to get a Plan G as in George. But the out-of-pocket maximum on a Plan G is $203. That's all you spend if you're on a Plan G for doctor visits and other services and under Medicare Parts A and B, and you've got a huge network. The premiums vary dramatically from state to state, from county to county, and do vary by age. We see in general in California, the cost goes up. Someone just turning 65 on a Plan G, their cost would be about $127 a month. And people we have that are over age 85, their cost is about $282 a month. You must be enrolled in Medicare Parts A and B to be eligible. And these are also known as Medigap plans. So there are a lot of factors that we look at. We consult with people to try to figure out the best course of action for them. And we look at who are the doctors you're seeing, what are the drugs you're taking, what are your travel plans, what are your likes and dislikes, do you have other special benefits that you're very interested in, and what is your budget? So our job is to try to match you up with those things that are most suitable for you. So we're authorized to offer a bunch of different plans, most of the major companies, and we have to go through about 50 hours of recertification every year in order to be able to even talk to you about these plans. We have no cost for our services, so if you talk to us over the phone, we'll be happy to listen to your situation, give you some suggestions and advice, even provide you quotes. We have no charge. We get paid a commission if you enroll in a plan that we represent. And we save people lots of time and money. I've had people that have spent 30 or 40 hours trying to understand all this stuff, and they're still confused and still not sure what to do. And we can usually figure it out in 20 or 30 minutes. So there are several different enrollment periods when you can enroll in plans. We're going to go through these briefly. So the initial enrollment period to sign up on a plan it's like you're signing up for Medicare. It's the 3 months before you turn 65, the 3 months after, and the month you turn 65. And you start with the effective date of your Part B, and you're guaranteed issue to get on a supplement plan within 6 months of the time your Part B starts. After that time period, underwriting would be required. There are special enrollment periods. Again, most commonly we use this when people leave an employment situation, but it also happens that people move. And I've got a steady trickle of clients that are selling their high-priced California real estate and moving to, I think I'm licensed in 18 different states now, moving there. And I tell them, let me know before you're going to move, because we can strategize and figure out what the best plan for you to have while you're in California before you move, because once you move, you may not have the options you've got in California to make changes in plans. I mentioned this earlier, but COBRA plans are not considered creditable coverage. So if you or anyone you know is on a COBRA plan and over age 65, you need to get onto Medicare as quickly as possible, because you could have a significant problem in terms of claims getting paid. Medicare plan open enrollment period, or OEP. If you're on a Medicare Advantage plan, you have a once a year time to change to a different Medicare Advantage plan, and that's from January 1st to March 31st. You don't have as many choices during this time period, so it's not the main time to focus on. You can also get out of a Medicare Advantage plan and go back to basic Medicare and enroll in a Part D prescription drug plan. So we encourage all of our clients to do a yearly Medicare review. And I also encourage people I know that are of younger age to check with their parents or other elderly relatives to see if they've reviewed their plans. We encounter lots of people that purchased something or made a decision at age 65 and have never gone back and reviewed it. And in some cases are paying thousands of dollars a year more than they should. So as I indicated in the slide, if still alive, whatever your parents plan, whatever your parents are on, whatever plan they're on, will likely impact your life at some point in the future. So why not take a chance now and look at what they're on, evaluate it, make sure it's the appropriate plan, and also make sure they're not wasting money. The annual election period is like a tax season for accountants. We offer to reshop all of our clients' existing coverages and make recommendations for the following year. So we're going crazy from October 15th to December 7th, but that's the time period that you can make a change. You can enroll in a Part D plan if you haven't. You can enroll in a Medicare Advantage plan if you haven't. And you make a change from one plan to the other, either for a Part D or Medicare Advantage plan. We use this site a lot. We live on Medicare.gov because it's where we go to input person's drugs, their pharmacy, and figure out which Part D prescription drug plan is the most cost-effective for them. I also wanted to show this. You can go on the Medicare.gov and look at the plan finder, and you can see all the Medicare Advantage plans, and you can select several, compare them. You can look at the different benefits that you're most interested in acquiring. Again, this is a tool that we use, but you're also welcome to look at it yourself. One of the questions that comes up periodically is, okay, I'm on a Medicare Advantage HMO plan and I decided I don't want to stay on that. I want to go to that other thing that you talked about, that Medicare Supplement plan. So there is no open enrollment for Medicare Supplement plans in California. You're guaranteed you can enroll within 6 months of when you get your Medicare Part B plan. And there are some special enrollments that do allow guaranteed issues, such as if you move out of the service area of your HMO plan or lose eligibility for Medi-Cal. Otherwise, if you want to move from an HMO to a Medicare Supplement plan, you'll generally have to answer health history questions and you can be turned down. California has a birthday rule. This is only for those people that are already on a Medicare Supplement plan or Medigap plan. So every year around your birthday, you have 60 days in which to look at the marketplace and see what's available. And you can make a change to any company and any plan as long as it's a similar or lesser benefit plan. No waiting period, no health questions. So we are constantly reshopping all of our existing clients' Medicare Supplement plans to see if there's a better plan that exists in the marketplace for them. Presently, we're moving a lot of people off of the older Plan F and onto the more relevant Plan G as in George. So I provide this on my website. We post it everywhere. I take out ads because I want people to take a look and shop at this. So if you have someone you know that has a Medicare Supplement plan or Medigap, you figure, this is Los Angeles area. So if they're in a different area, this is not relevant. What's their age? Are they on a Plan F? And if so, how much are they paying? And you can look here and see, so someone age 76, if they're on a Plan F and they're paying a lot more than $264 a month, they might want to make a change to another company that's offering a much lower rate. And they might also consider making a change to a Plan G as in George. So the only difference between F and G is that with G, you've got a once-a-year deductible of $203, but we're moving lots of people to Plan G where we're saving them $700, $800, $1,000, $1,200 a year. So the deductible is meaningless. And again, birthday rule in California gives the ability to change to any company similar or lesser Medicare supplement plan on a guaranteed basis. Some of you may have a retiree plan, and we're seeing fewer and fewer of those. Still a lot of people from LAUSD that are retiring, and I rarely find that someone on a retiree plan needs my help. Usually they're just calling me to get a reality check. Typically the plan's benefits are good, the cost is low, the drug benefit is more robust, but I've also had people that were significantly overpaying for their retiree plan that made no sense whatsoever. I had one woman that was paying $500 a month on a retiree plan that was an HMO, and I moved her to a plan that had a 0 monthly premium, and boy, was she happy. She saved a bunch of money. We are also seeing a trend line of companies and entities eliminating their retiree health plans. So this last year, SAG-AFTRA eliminated a program, I think for about 10,000 people in a very specific narrow range, and replaced it with something not nearly as attractive. So keep an eye out for that if you're on a retiree plan for changes that might be coming. So I'm going to talk a little bit about Medicare supplements and some strategies. There's currently 12 potential plans available, and we recommend choosing the most cost-effective option and then periodically reviewing. So the plans that are available right now are A, B, D, G, K, L, M, N, C, and F. And yes, wasn't it wonderful that Medicare has parts A, B, and D, and they also have Medicare supplement plans with the same letters of the alphabet. So Medicare has done some things to make this a little more complicated than it should be. Again, plans C and F are only available if you became eligible for Medicare prior to 2020. Mostly we look at plan F for those people that are eligible, plan G, and plan N. I've got an analysis here. This is just the Medicare plans and rates. This is for 2 people, both new to Medicare at age 65. And we're talking about putting them on plan G, and you can see what a difference the rates are from one carrier to the other. And people say, well, why is there such a difference? This is just what the carriers have decided they're charging. So we look at this on a regular basis, and we're always wanting to move people to the plan that has the lowest total overall cost, because every carrier on this column, the benefits are identical. So it's just a question of what the premium is.
Excuse me, Paul.
Yes.
It's 11:30.
Thank you. So Medicare supplement strategies, we regularly employ this strategy. When we enroll someone at age 65, we put them with a particular company, typically leave them there for about 5 or 6 years. Then we move them to a different company where the rates are lower. And then at age 75, we typically move them to another company. And in doing so, we're saving them $5,600 over the life of if they had just signed up on one plan and stayed with that the entire time. So this is where we earn our keep. Medicare supplements have discounts. Many plans offer 2-party discounts if both husband and wife or 2 people living at the same address. And sometimes they require you to be on the same plan, but other times not. So we take all these discounts into account in finding the best possible value proposition. Medicare planning for people on the move. Yeah, I mentioned earlier, we have almost, I'd say weekly, we're getting a couple of phone calls from people that are thinking about moving or are already moved, or someone that they're relocating their parent to California so they can better take care of them. So we ask our clients, let us know as far in advance as possible when you're going to do this move, because we'll help strategically look at and figure out what's the best plan for you to be at and position you. So I haven't updated the slide. It's now 18 states. So if you're in California and you're thinking about moving, we want to try to take it, and you're on a Medicare supplement plan, we want to try to take advantage of the birthday rule in California for the last time, because most states do not have a birthday rule. Most states, if you have a Medicare supplement or Medigap plan and you want to make a change, you have to answer full health history. California is one of only a handful of states that guarantees you the right to change. So when someone tells me where they're moving to, I investigate the county and zip code they're moving to, and I figure out what plan I should move them to while they're still in California that will produce the lowest cost when they relocate to that other state. So it's a whole thing, a whole separate segment of our business is helping people on the move. You should have received a Medicare and You booklet. This is your guide to Medicare plans. If you don't, you can download it, and I'll show you on my website, pdinsure.com. I've got a bunch of different resources you can click on, and download documents that will help you in looking at Medicare. What changed in Medicare in 2020? They eliminated Plan C and F. So those are plans that had no deductible. And that's if you turn 65 after January 1st, 2020, you cannot get a Plan C or F. What changed recently? Coronavirus covered under most Medicare health plans. There's a really great new programs for people that are on insulin. And if you didn't review this during the last annual election period, you really should, because we've saved people thousands of dollars over what they were paying because of some new cost sharings on many insulin products. If you know someone or someone has a end-stage renal disease issue, they can change to any Medicare Advantage plan. It used to be just a handful of plans that they offered. And now acupuncture is covered under Medicare, but the trick is finding a medical doctor that also does acupuncture. And telehealth services are imbued in just about everything. So there's lots of things you can do over the phone rather than get in front of your doctor. Medical cost assistance. If you or someone you know is challenged by the cost either of your prescription drugs or Medicare Part B, then you're likely eligible for some sort of assistance program. And I tell some people I talk to this, well, I don't want to sign up for Medi-Cal. You know, that's for people that are poor. And it's not, you know, if you're eligible for some of these programs, you want to take advantage of them, because otherwise you might have to make some choice between whether you want to use your money to buy food or buy your medications. So this, I know, is a very busy chart, but if you have Medicare only and your assets are less than $14,790 or $29,520 for a couple, and your income or assets, you're eligible for extra help, which means it could help cover the cost of your prescriptions. So if you're unsure, you want to get in touch with the state Medi-Cal office or Social Security and say, I want to apply and see if I'm eligible for Medi-Cal or low income subsidy or extra help. It can be a life-changing experience. I had one woman, her drugs were going to cost her $3,000 a year. And on low income subsidy, it dropped to $200. If you've done all you can, you're not eligible for Medi-Cal or not eligible for low income subsidy, we found you the best possible Part D prescription drug plan. I've got this fact sheet from the California Health Advocates that talks about several dozen things you can do to try to reduce your drug cost. Two of the ones I'll just share is ask your doctor for free samples and ask them at the beginning of the year while they still have some. Secondly is you can go to a website called goodrx.com and shop your drugs. And sometimes the cost there is lower than under a Part D prescription drug plan. I don't know how they do it, but we know that it helps. So a lot of times when we talk to people about Medicare, I think this is what they're visualizing in their head, these just unknown equations and formulas, and it just makes no sense whatsoever. And my goal is to take that and boil it down to a point where I can give you some straightforward, simple advice that you can understand and some direction. A lot of people call me a Medicare guru, and I think I know more than 98% of the insurance agents that are out there enrolling people in these products. And I know I have a number of insurance agents that contact me with questions that they don't know the answer to. So now's the time for any questions. If you put them in the chat box, Jerry will come in and he'll read the questions to me, and we'll get those answered. So Jerry, unmute yourself, Jerry.
Nothing right now.
Okay, I see several things in the chat, but there weren't any questions.
There's no questions. I would just place the telephone number, their website, and your email on there, paul@pdinsure.com, and telephone number 818-888-0880. So don't forget, everyone, that you can use the raise your hand function as well. That way you're able to verbally ask a question to Paul and Jerry, or you can use the Q&A box at the very bottom if you want to ask a question anonymously, or you can just use the chat function, whichever is most comfortable for you.
And if there's a question that's very specific to you, give us a call. Again, I will talk to anyone that calls. Well, I won't talk to anyone that calls. If there's salespeople, there's some I won't talk to. But if you have legitimate questions about your circumstance or you're puzzled by something, I find so many times people call me and say, Paul, I've called 6 people, I've called 6 agencies or 6 places, and they will not give me the answer to this question. And I said, what's the question? And I give them the answer. So why couldn't they tell me that? And it's either they're restricted from saying certain things if depending on their setting, or they simply don't know. So I consider myself a wealth of information for people that are just trying to figure this stuff out. So give me a call. If I'm not available, my assistant will schedule a phone appointment for you to call me back. I'm doing these sorts of webinars and meeting with clients all day long. So I'm not always available when you call, but I will call you back and answer whatever questions you might have.
Paul, typically how fast, if someone was to give you a call today, like would it be like within like the next week or two that they would be able to get into your office?
If they called me today, I would either call them back later today, or I do work Saturday, usually from 11 to 4, or Monday or Tuesday of next week. But yeah, it would be no later than Tuesday of next week that I would get back to someone.
Awesome.
And if they have an urgency, like they're supposed to start Medicare July 1st and they haven't done anything, then they should call me today and they should express to my assistant that this is an urgent situation, because yeah, we could still make it happen for July 1st. But if you wait till next Wednesday, not so much.
So everyone, if you know of anyone that is in this situation, have him for sure give Paul a call. Like tell him to get on this call. You have to share this recording. You have to call him ASAP.
Yeah. So this recording will be available on the ONEgeneration website, and I think it'll be in the newsletter. So if you thought this was useful or valuable, encourage someone you know that's confused by this. And also on my website, pdinsure.com, I do have about 5 or 6 webinars that are recorded, and you can go there and listen to them and get a little more familiar with this.
Perfect. So we do have a question. Do you have opinion on long-term care?
So I used to sell long-term care insurance. I'm not doing that for about 6 years now. I've gotten so busy just with Medicare that I have no time for any other types of insurance. I do have an opinion on long-term care insurance. If you have assets to protect, it's probably a smart thing to look at. My mom had long-term care insurance policy, and she had an estate that was a couple $100,000. But with her long-term care insurance policy, it paid out over $400,000 over her last 4 years of life and preserved much of her estate to pass on to myself and my brother. So I think of it as an estate planning tool and an asset protector. And I have a very good agent that I refer people to that all he does is long-term care insurance. And he actually taught classes that I had to go to for continuing education when I was marketing that product. So it's not for everyone though, because it's not cheap. If the ideal time to look at long-term care insurance would be if you're in your 50s. If you're 65 and looking at it, you're probably looking at $5,000 or $6,000 a year per person for a meaningful benefit. So it's not something to take lightly, but I tell people, take a look at it. There are also products now that mate long-term care insurance with an annuity and with life insurance. So it's not just simply that pays for long-term care. You can get your money back in a variety of ways. But contact me and we'll refer you to the agent that I work with.
Thank you for that question. It's a good question. Does anyone else have any additional questions?